It's Lauren Hartman here to talk about age-friendly communication skills. You know how kids aren't just little adults? Well, old people aren't just wrinkly young people, and you can't talk to them in the same way that you talk to your younger adult patients. In this short video, we'll discuss communication tips that you can use with your geriatric patients, and we'll frame the discussion using AIDIT. AIDIT is a best practice framework of 5 interactive behaviors used to establish effective communication. Using AIDIT can build rapport, increase trust, and improve patient satisfaction and provider satisfaction. Let's discuss each behavior, taking into account the unique characteristics of the geriatric population. The A in AIDIT stands for acknowledge. By acknowledging our patient, we're trying to show courtesy and respect. Even though a patient is slow or old, they still deserve courtesy and respect. Remember the 5th commandment. The key message with acknowledging is you are important. You'll want to greet patients by name. And for the older patient, be sure to use a formal address such as Mr., Mrs., or Doctor. Always introduce yourself by name, even on return visits. Don't assume they'll remember you. Next, ask if the patient can hear you. Half of patients above the age of 80 have hearing impairment, but that doesn't mean that you should shout at them. Normal aging actually reduces the ability to hear high-pitched tones and consonants. So, speak clearly in a normal or lower pitch and ensure hearing aids are in place and working, if the patient has them. Also, if the patient uses glasses, ensure they're on. This will facilitate lip reading, which will help comprehension. Restoring sensory function is important for communicating and also can help prevent delirium in the hospital. For all geriatric patients, you'll want to speak slowly. This is because the brain's processing time slows as we age. But be sure to avoid baby talk, which can be offensive and degrading. Next, you'll want to greet everyone in the room one by one. You won't remember their names, but if you do, you'll look like an all-star and they'll remember you forever. Always ask how others in the room are related to the patient. Never assume. If your patient is cognitively impaired from dementia or delirium, you may be tempted to direct all of your communication to their family. But don't. This can be intimidating and anxiety-provoking and cause patients to feel outnumbered and ignored. If a caregiver is present, try to sit so that you form a triangle and can address both the patient and caregiver face-to-face. Communication tips that apply to all patients, not just geriatric ones, include maintaining good eye contact and positioning yourself at the level of the patient by sitting. Research studies have shown that sitting instead of standing in a patient's room actually increases the amount of time a patient perceives that you've spent with them. However, if you can't sit, consider kneeling, squatting, or leaning. Introductions build trust. And tell your patients, you can count on me. Introduce yourself again with your role. Then introduce your team with every member's name and role. It's helpful to manage up or speak positively about other care team members. Give patients clear expectations on how long you'll be talking with them or how long they'll have to wait for something. This will convey respect. You'll want to provide estimates for pretty much everything from your H&P to wait times, length of procedures, timing of test results, and length of stay. It's often helpful to report progress so that your patient or caregiver knows that they are not forgotten, and to circle back with the patient or nurse if plans change. Okay, now that you know the patient can hear you, before you take a 30-minute history, you'll want to make sure that your patient is not cognitively impaired and is actually providing a reliable history. It's often possible to achieve this in friendly small talk. Next, provide an explanation to keep your patient informed. This tells patients, you have a right to know what I'm doing and why. To effectively explain, use patient-friendly terms to explain what is happening and what to expect. One of the most important parts of effective explanation involves active listening and asking patients to teach back to you what you've explained to them. It's always good to finish up by asking, what questions do you have? The quality and clarity of information that patients receive from their physicians are key drivers for patient satisfaction. Lastly, we can show courtesy and respect by thanking the patient, sending the message, I enjoy helping you. Try telling patients, "Thank you for allowing me to care for you," or "Thank you for taking the time to talk with me today." Be sure to thank the caregiver. Your encouragement and praise can help to sustain a caregiver who may be suffering from stress or burnout. Finally, you can ask what else you can do to create a positive experience for your patient. So, when you put it all together, it might sound something like this. "Hello, Mr. Smith. I'm Dr. Hartman. It's very nice to meet you. Can you hear me okay? Good. Who do you have with you? Oh, your wife of 50 years? Wow. Well, it's so nice to meet you, Mrs. Smith. Do you mind if I sit down? Well, I'm Dr. Hartman, a geriatric doctor, and I'll be your attending physician while you're here in the hospital. This is our whole team here. You know Maddie, your bedside nurse, and this is Christina, the pharmacist, Brett, the charge nurse, Lucy, the resident doctor, and Rob, the intern doctor. We also have a social worker, case manager, dietitian, and physical and occupational therapists that work with us, and you might meet while you're in the hospital. If it's okay with you, I'd like to take about 10 minutes to discuss your case among the team, do a physical exam, and then at the end we'll explain everything to you and make sure all your questions are answered. Is that okay with you?" While this approach does take some time, it never fails to pay off in the end. So, remember, use AID-IT, speak slowly, but avoid baby talk. Adopt this approach, and I think you'll see that patient perceptions of communication drive satisfaction, trust, and clinical outcomes. Thanks for tuning in. Until next time.